It's 5 o'clock, that time we get together every day, every single day. And we will keep getting together every day until we have defeated this coronavirus. We can do it. We will do it. And I know it feels like we've been at this a while, but we've got to do what it takes to win, and you are doing an amazing job. I've said it a lot. I couldn't be more proud to be your governor because you are passing this test of humanity. Now, a test of humanity isn't going to be easy, right? It's not just going to be changing our life for a couple of days. So stick with it. I know we talked yesterday and we'll talk today about our guidelines for reopening. We will get back to a new normal, and eventually we'll get back to just normal. But let's make sure that we keep doing what we have to do to save lives. This is a chance for everyone in Kentucky and everyone across America to be a hero, to just do the right things, knowing that when we do the right things, we protect each other and save lives, and when we don't, we put someone in harm's way. So let's keep it up. And let's start the way we always start, by saying and knowing that we will get through this. We will get through this together. Say it with me. We will get through this. We will get through this together. One last time. We will get through this. We will get through this together. And we will get through this because we know what it takes to defeat this virus. Think about it. In other challenges and other crises, they didn't have the same information, the same knowledge that we do. But we know the 10 steps that it takes here in Kentucky to win, to beat this virus and to protect one another. Number one, always number one, is healthy at home. You ought to be at home if you're not getting exercise, getting supplies, or going to work. Healthy at home is still absolutely critical. And I know we feel cooped up, but if rising to and addressing the challenge of our times is just about making sure we stay home so other people stay safe, then that is what we've got to do. It's about avoiding crowds and gatherings. Again, absolutely no exceptions. I'm told, though I haven't read it, that there's an article out from Indiana that's about a sporting event that they can now trace a number of cases of COVID-19 to. Any crowd can spread the coronavirus. Practice social distancing. This doesn't mean we get together and just stay 6 feet apart. It means when you are around people, when you are running, when you are grocery shopping, always staying 6 feet apart. Again, all of these steps are incredibly important. Make sure you continue to apply for benefits. We want to make sure everybody has enough to get through this and to come out strong by prioritizing our mental health. Continue to wash your hands and disinfect surfaces. Clean multiple times a day. And as we talk about reopening, oh boy, this is going to be incredibly important. If we as a people can't practice good hygiene at a time when we'll gradually start loosening things with the coronavirus still out there and still being deadly, it'll keep us from doing what we need and want to do. So we always talk about the 10 steps plus one, fill out your census. Again, this is so important on federal dollars that regularly flow to Kentucky. It doesn't take long. If you're watching and you haven't done it, please do it tonight. It only takes a couple of minutes. If you're watching, you have bought in, you are doing your duty, you are a part of Team Kentucky. It's a very small thing that we're asking as a part of Team Kentucky that will help us help our fellow human beings, just like we're doing by following the various rules that we have. We also ask you every day to do the right thing and to show other people that you're doing the right thing, to fill up social media with your positive work and positive examples. So let's see a little bit of what we have under Team Kentucky Together KY, Patriot, and Healthy at Home. All right, this is some of the staff working on COVID-19 testing. Remember when we talk about our healthcare workers being heroes? This is them testing folks that are likely to have the coronavirus. But that's the only way that we can identify and eventually get to a contact tracing point again to try to get to at least our new normal. Now remember, the best thing you could do for these folks is not deliver food, though they appreciate that. It is to stay home so that they can work to defeat COVID-19. All right. This is an example of not just chalk art that we see, but the positive messages that people are putting out there. This last week, a lot of national attention is focused on about 0.1% of folks that don't believe what we're doing is real, or are just willing to accept a certain number of deaths. That is not what 99.99% of all Kentuckians believe. And when we see these positive messages out there, we know that we are more unified than ever before. You think about issues that divided us, 2 months, 3 months ago. All of a sudden, we're not thinking about those. We're thinking about what we're all doing together to help one another. We are as united as we have ever been in my lifetime in this state. And I wish it didn't take COVID-19 to do it. But again, it's that you are willing to do what it takes to protect your fellow human being. I'm not only proud of you, but you're saving lives. It's important. All right, so we got to continue to donate blood. Very important even during this virus, and I know it can seem scary, but it's important to those who might need that help, especially battling this virus. All right, so we miss special days and special times with family because of this. And it's a sacrifice. Remember, this 3-year-old and her family are willing to sacrifice to keep everybody else safe. So don't be one of the individuals that frustrates her sacrifice and her parents' sacrifice and her grandparents' sacrifice, maybe your great-grandparents' sacrifice, by doing things that knowingly spread the virus. That frustrates what this amazing little girl and everybody else around Kentucky is doing. Be a part of our unity. Be a part of defeating this virus. Don't be that individual that's going to keep it around longer or is going to make it take a larger toll on our people. All right. This is WKU, a wonderful university, and one of our professors who is donating her time to create PPE. We're seeing this all over Kentucky, especially in face shields. We have seen an incredible outpouring of support. Dr. Stack showed you 2 days ago a little bit of the PPE. We'll show you more as days go forward. There are 3 different ways that we get PPE. Number 1 is to buy it. It's been incredibly hard, but we've had more success recently. Number 2 is to manufacture it, and number 3 is to donate it. Don't stop donating it. Remember, one of the guidelines on when we're going to be able to start loosening restrictions is having enough PPE in our healthcare system to know that we can handle a surge if and when it comes. Because remember that graph, it's Philadelphia versus St. Louis. The second bump in St. Louis was more deadly than the first. So as we open up, we still have to be prepared for any future surge. All right. Again, grandparents seeing grandson. Again, difficult to not be together, but knowing that protecting those grandparents, and we now have a 12-day-old baby that has this virus, that it protects everyone. By the way, that 12-year-old is doing well. 12-day-old is doing well. We just got another update on that kiddo today. I love this. This is Meade County, and it is just one neighborhood. You want proof that we are one people united to defeat the coronavirus? Look at all those green lights in one neighborhood. And the demand's getting so much. I know the Fayette County Sheriff is distributing them, and many others, because green is the color of compassion. It's how we're remembering those we've lost. It's also how we're renewing our fight every night, every morning, to make sure we do what it takes to get through this. Every day we see more of these, because every day we lose more people. And we're going to need to light our homes up green tonight. We're going to need to ring our bells tomorrow at 10 a.m. We are going to do what it takes to defeat this virus. And you just look at this neighborhood. and you know we're together. Okay. This is another person recovered from the coronavirus, now in Owensboro. Did you notice the caption? Did y'all read it? He was on a ventilator. He's in the ICU on a ventilator. And now he's going home after defeating the coronavirus. Thank you very much to Owensboro Health. We have such an incredible group of physicians and nurses and other folks in these systems. They have taken on this virus, and they have done things that no one who's ever done the modeling or the predictions ever thought was possible. Everyday heroes saving lives, and the reason they have enough healthcare capacity to do that, to have that ventilator, is because you have stayed healthy at home. You are also a part of that individual being okay and so many other individuals not being in the hospital in the first place. So let's talk about where we are. First, let's look at our graph of Kentucky versus other states. You continue to do incredible work, and even as adjusted by population, we are doing better than virtually every other state in this country. But we're doing it because we have been committed, we have been bought in, and we have been willing to do what it takes. We acted early, and so many out there have sacrificed and continue to sacrifice, worried about the future. I get that, but what you are doing is working. And what I like is that not only did we not go up as fast and as steep as other states, but look at how our curve, even though we're going to have a big number today, look at how our curve is starting to flatten just in number of new cases in this graph. I did put up South Dakota, which is a state that hasn't done a lot of the things that we have done, and over the last especially couple days is spiking up instead of flattening out. So what we've done is incredibly important. And remember, our actions that we take today show up 2 weeks from today. So it's incredibly important that we remember every single day that our decisions really matter. Let's put up a heat map of Kentucky and its counties. This is on our KY COVID-19. I did an interview with another group today, and they pointed out one county, and it was Metcalfe County. And their point was it doesn't have, I guess, a documented case of the coronavirus. Every county has the coronavirus. And you just look at what surrounds Metcalfe, and you know that there are folks that are asymptomatic or even sick in every county, everywhere. And I know our local leadership in Metcalfe and everywhere else have been acting like that and have been putting the right steps in place. They have been aggressive like we have, and we appreciate that from them. When you look at this heat map, it says two things to me. Number one, it's everywhere. It's everywhere. I mean, it doesn't stop at a county line, so if you see every county around having cases, then that county does. But you also look that we have had places in Kentucky hit really hard. And it's not just places with larger populations. You look at western Kentucky and what's happened there, how it has not only spread, but nursing homes have been hit hard there and in other parts of the state. It just tells you that this is a virus that can spread very quickly, regardless of population, and we got to make sure that we are working every single day in every single part of the state to do everything that we can. Testing update. So today was the last day of our 4 days in Kenton County. It has been our best drive-through testing to date. That drive-through testing is a partnership with Kroger that is providing people and PPE for the testing, and they are donating 100% of that. We as a state aren't paying for any of that. Then we contracted with Gravity Diagnostics and UPS to handle the other end. So Kenton County today did over 212 tests. That means over the 4 days they did 848 in Kentucky, at least as far as the state's concerned. That's the most successful drive-through testing to date, but I think we can do even better. So starting on Tuesday, Madisonville, Paducah, Somerset, and Pikeville will have drive-through testing that the state and Kroger are putting on. We need you to sign up. Again, here is how you sign up. You've got to go through the portal. If you are anywhere in those regions, you don't have to be in that county or even in a contiguous county, just in the region, and you meet any of the criteria, we need you to sign up. So if you have symptoms, sign up. Let's make sure we get you tested. If you are a healthcare worker or a first responder and may have been exposed, sign up. Let's make sure. People with symptoms that also may have been exposed that are milder, sign up. We want to make sure that we get and try to get more than these 848. I'd like to get 1,000 tests done in each of these locations over the next 4 days. We'll announce our next locations this coming Wednesday, and that announcement is going to have some additional services that are going to be worked in to those locations. Testing and our testing capacity is going to be incredibly important as we move forward. Let's talk about that in terms of the 7 benchmarks that we put up yesterday. Yesterday, I know we went long because we were talking about our benchmarks for when and how to open the state, and that reopening is going to happen gradually, and we're going to start seeing some small steps in the week ahead, and then some more as we go through May, and then hopefully a lot more. But our benchmarks, as we look at them, are first the number and rate of new cases. Again, this is something that we were thinking about, but the White House came out and said you need 14 days of decreasing positive cases or a decrease in the positive rate before you start engaging in any of these steps. This isn't just something we were thinking about. This is the White House guidance too. Again, people try to create divisions. There's not. All science is the same. You move out some of the rhetoric in any direction, and the science and the data is the same. What we need to see are decreasing number of cases. In other words, that we're coming down on that curve. And even though I think we've plateaued, that we are as opposed to having a curve at the moment, we've cut it off and are at a plateau. We still need to start seeing a decrease, but that's something everybody can watch. We're going to have a big number of cases today, but on the 3-day average, it's still about a plateau. What we'll need to be seeing is a dropping, but when everybody starts seeing that, they know that we're moving in the right direction and where we're going. So to do that, we absolutely have to have increased testing capacity and contact tracing. This is where we're going to move into a new normal, where when we're going to be able to slowly open things up, it's still going to be a lot of people being tested at different times, even if they're asymptomatic. And what will happen, and this is the new normal, this could be hard for a lot of folks to accept, is if you test positive, even though things are opened up, you're going to have to be self-quarantined for a period of time. And you know what? Everybody you came in contact with, they probably will have to be too. That's the way that we can do this a little bit quicker. So we've got to have increased testing capacity to get there. And that's not just about the number of machines or the number of labs we have. The real challenge right now, and it's all over the country, is swabs. Dr. Stack showed you those. They're the things that go up your nose to do the test, or potentially a saliva test that's coming around. And the challenge right now is those numbers. There's testing capacity in Kentucky that we can't use because we don't have enough swabs. So it's not how many tests we could do theoretically, it's how much of the materials do we have to do a test. I was on a call with other governors this week. That's in many places across the country. That is the challenge. It's also the liquid that you have to put the test in to transport it to be tested. That's the reagent, and that is also a challenge to find across the country. And so everything that everybody wants to do across the country is somewhat dependent on the materials, meaning the swab and the reagent. We are going to be working very quickly on the contact tracing piece with the CARES Act money. The CARES Act money is going to be very helpful in staffing up the number of people that you would need to do that. Our hope is to begin next week providing some numbers on these. Obviously, the 14 days, you can follow our numbers every day, but on availability of swabs versus capacity, right? How many tests could we theoretically run, but how many materials do we have right now? Personal protective equipment, we're working on that every day. Again, donating that can be an important part to helping us be able to do things earlier. This is going to be really important for our healthcare industry. It's also important for our employers. So for those that watched yesterday and you are an employer, you ought to be thinking about a couple things. Number one, am I going ahead and getting the materials I will need for temperature checks? Because you will need to do that every day for all your employees. That's in the guidance. Number two, have I thought about how to socially distance in my workplace? If you're thinking about going back in the same way as before, you're not thinking hard enough. We're going to be working with industry on those plans. Number three, what type of PPE do I need in my facility? Again, ability to protect at-risk populations. Eric Freelander is going to talk about that in detail. It's where this thing is now hitting really hard all over the country. Ability to social distance, follow the CDC guidelines. It's going to be easier on some areas than others. Those areas are going to be able to open up faster. It's just the nature of the virus. Preparedness for a future spike. We know that that's the way these pandemics work. And so we have got to make sure that we are working smarter and that we take everything that we have learned and know in this day and age and make sure that we can protect people. And then, of course, we'll always be looking at the status of the vaccine and the treatment. But just wanted to talk through this once again, and we'll be able to again, try to provide some metrics about where we are in all of them. Because these are the same general guidelines that everybody should be looking at. And remember that our decisions are going to be made data-driven with science, obviously wanting to do everything we can to get to a new normal, but to do it safely. And while you'll see some different headlines from different places around the country, that's what everybody's trying to do. Whether a snippet that's taken from them or me sounds exactly the same, I can tell you that every governor that I'm working with, this is what they are trying to do. All right, let's move into today's numbers. Today's number of new cases, I think, is our second highest we've had, though if you look at a 3-day average, I mentioned I expected yesterday's to be much higher. It's still, we believe, kind of around that plateau. We have 206 new cases of COVID-19 to report today. When we remove duplicates or those that don't meet the definition of a confirmed case that we had in, we're reporting our total number of cases as 2,707. That's 2,707. Our total numbers tested to date, 32,225. You're going to see that increasing a bunch when we have 4 sites up. Our drive-through sites have about a 48-hour return. And remember, when we see all these numbers, even the 206, it's a mix of one-day turnaround, which our state lab does, about 12 hours. Our Gravity that does about 48 hours by the time all the reports go through. But then we got some national labs that can take 10 days to 14 days, and it makes it a challenge because those are all cases that were positive on different dates. It's just the reporting comes in all at one time. Number of Kentuckians ever hospitalized, 1,059. Currently hospitalized, 274. I believe that's up a little bit from yesterday. Ever in the ICU, 534. Currently, 155. I believe that's down from yesterday. And if that's true, that is really good news. Remember, they call it intensive care for a reason, so let's think about these 155 individuals. And the number recovered that we have today, 1,174. And out of 2,707, knowing that there is a significant time that it takes to recover, that is great news. That is really great news. Right now, it's about 46%. And that's what when we always looked at, you hate to talk about a mortality rate, but we expected a lot of people to recover. But for every person and every family that has gone through this and has recovered, we are so happy for you. But not every family gets that result. Every day we are losing Kentuckians, and the numbers of deaths can continue to grow. And we're reporting 7 new deaths today, which bring our total to 144 Kentuckians that we have lost. So tonight, let's again light our houses up green in honor of these 7 Kentuckians and the 144, knowing that there are 7 new families grieving, along with the others, at a time when the world doesn't seem right, and it's harder for people to connect with them and to try to carry part of that grief and that load. You know, every time you lose a family member, you feel alone in different ways because that person's not there with you. But right now, you got to figure that these families feel even more alone. So let's remember that every single one of these families want us to do our part to make sure this doesn't happen to another family that's out there. The breakdown on the new cases by county are 96 in Jefferson, 15 in Warren, 12 in Graves, again, Western Kentucky hit hard, 9 in Franklin, 7 in Kenton, and we will expect those numbers to increase a little bit because we're doing a ton of testing up there, and folks are typically have to be symptomatic or potentially exposed to get the testing. 6 in Butler, 6 in Fayette, 5 in Hopkins, 4 in Davis, Grayson, Muhlenberg, and Ohio counties, 3 in Henderson, 2 in Adair, Anderson, McCracken, Union, Webster, and Woodford, and 1 in Allen, Boone, Bourbon, Breathitt, Breckenridge, Hancock, Jessamine, Knott, Pulaski, Russell, Scott, Shelby, Simpson, Taylor, and Todd, and we're still trying to confirm 3 of those 206. And the new deaths are a 78-year-old female in Pike, a 95-year-old female in Jefferson, a 96-year-old male in Grayson, a 95-year-old female in Jefferson, an 83-year-old male in Butler, an 85-year-old female in Kenton, a 90-year-old male in Campbell, and a 63-year-old male in Jefferson. 7 more folks that we've lost. Let's just be committed to doing a little bit better tomorrow in everything we're doing to defeat this virus. The ethnic and racial breakdown, which we're now given every day. We know the racial data, 78% we know of overall cases, and within that unit, 79.3% white, 12.33% African American or Black or African American, 3.43% Asian, 4.8% multi-racial. And of ethnicity of all cases, 93% non-Hispanic, 6.89% Hispanic. Deaths where we continue to see disparity, unacceptable. Disparity is, we know the race of 82.64% of all deaths, 78.15% of that are white, 21% is Black or African American, 0.84% is Asian. And on ethnicity of 82%, which we know, 99% non-Hispanic, and 1% Hispanic. So we're moving a little faster today, but it's Saturday, so I'm sure those that don't mind, let's just go through a couple of our areas that we've shown you every day where we've had some real concern. Green River Correctional Complex has 5 new cases. All 5 are inmates. This continues to be of great concern. Any kind of closed facility, the virus can really spread in. One of the reasons that we got to be real careful in all the steps that we take. Western State Hospital today is the same. No new cases, and we are happy about that. We don't have slides on this, but we mentioned yesterday Hazelwood in Jefferson County, also the same. 3 inmates and 3 staff. Roederer in Oldham County, same, just 1 staff member. But the area of particular concern is our listen, they're all concerned. That's why we have these slides up there. That's me misspeaking. We wouldn't be showing you Green River and Western State Hospital every day if it wasn't of great concern. The area that we see the largest increase would be, the right way for me to say this, is our long-term care facilities, because today we have 40 more residents and 6 more staff and 3 more deaths. So today, Secretary Freelander is going to talk about the steps that we are taking. Remember, this is what this virus is, and we're fighting it hard, but this is how devastating the virus can be, and why we have made the sacrifices we have. These are big numbers. They would be a lot worse right now if we hadn't shut down all visitation, and if you all hadn't been out there taking the steps and making the sacrifices that you are.
Governor, as always, thank you. Thank you. So today I am going to address long-term care, but before I do that, I need to let you know that this is personal. One of the deaths reported was a friend of mine, a friend of my family's. This person was a friend of my parents from the 1950s, was raised with her sons and daughter. A couple of us went to the same college. And this is a beautiful, wonderful person that we lost. So this is personal. It's personal, and it should be personal to us all. This is something that none of us can wish away. So long-term care facilities are our biggest challenge. It's the biggest challenge across this country. Long-term care facilities, because of the way that they're designed, because of where this virus goes, these are the places that are most at risk. So what have we done up till now? Well, first we focused on infection control. Any facility that had reported somebody that was a positive patient, the Department for Public Health, the infection control group would be in contact with that facility. You heard Dr. Stack talk about being on phone calls with those facilities. The Office of the Inspector General, when they have to go into facilities, they focus on infection control. This is the most important thing that we have been focusing on. So after that, you've heard about medical students who volunteered to go into places to help support staff when they get overwhelmed. Just tomorrow and the next day, additional staff are going into some of these facilities, really sponsored by the Cabinet for Health and Family Services, to go in and assist and support these facilities. These are important steps, but we had to do more. We were looking at what are best practices, what are our national guidelines, and really at this point, it's an evolving field. So what we did was, about a week and a half ago now, we brought together a team of experts, a team of Kentucky experts that were recognized nationally to help advise us and help advise facilities on what are their best practices. This group has come together several times already. You know, a lot of task forces don't actually work. This is not true of this one. This is a task force comprised of people who want to get things done. And so what they've done is they've advised us on our recommendations to facilities, and they've looked at what are the unique features of these populations. Oftentimes, a lot of times, you're looking for fevers. Well, that's not what you see in these populations within long-term care facilities. So they advised us on what folks needed to look for in the facilities when they were worried that somebody might be getting sick. So those recommendations are out there. When do you transfer somebody? When do you have somebody in a facility? When do you bring folks together? It's called cohorting within a facility, that you bring the positive folks together and separate them from the rest of the facility. These are all recommendations that are going to be up Monday and Tuesday, and we are continuing to provide recommendations and guidance to all these facilities as we move forward. And these are strong pieces that help support the facilities. They're also advising us on when we need to bring staff into these facilities. As I said, we were already bringing staff to some of these facilities, and we'll have a group of folks, a group of medical professionals that will be able to provide to facilities as they need them. And they're advising us on how to do that. They've advised us to make some changes in our regulations for things like medications available on an as-needed basis in the facilities and how to expand that. We're making changes to our regulations to do that. We've also talked about and are going to change some of our Medicaid policies around how long we hold beds in facilities, how long we pay for beds in hospitals. We're going to make these changes because we know we have to support our facilities as we're doing that. Our behavioral health team, you saw the Western State Hospital. They're coming up with what's called a trauma plan. You heard Dr. Stack talk about being on a phone call with an administrator that was breaking down because they know these people are in their charge. They feel responsible for the care that they're getting. So the behavioral health department is going to come up with some guidelines to how to take care of staff. We've already provided support to a couple of the facilities for how they work with their staff, to how to support their behavioral health, because they're going through trauma too. So we're trying to provide these, and we are providing these guidelines, we're providing guidance, and we have additional partners. They suggested that we come up with a 24/7 phone line. Well, our friends and partners at Norton Healthcare have again stepped up, and they're going to staff a line with an APRN, an RN, on a 24/7 basis. They're going to work with our infection control team. They're going to help advise facilities when they run into issues, and they're going to do that based on the guidance that this group is providing. So these are the things that we're trying to do, and we're trying to make sure that these facilities are safe, that these facilities are supported. And when an infection gets in any of these facilities, it's not because the facility did anything wrong. You can look across the country and see this. These facilities take their responsibilities very seriously. These are residents in their charge. And so we're going to support those facilities, and we're going to give them all the resources we can. We're going to prioritize testing for them when they need it. We're going to prioritize PPE when they need it. The first tier, of course, is acute care. But as we move through, this is a very important group for us. So again, this task force is helping advise us when we provide this. So I'd just like to thank them for volunteering to help us. They're going to help us on an on-call basis. This is a group that's been very powerful for us. And so I just want you all to know how seriously we take this, because this is personal to me, it's personal to the governor, it's personal to Dr. Stack, and it needs to be personal to each one of us. Thank you.
All right, we'll move into questions. We have three reporters here today. We have Shelby Lofton and Eleanor Buckley and Joe Sonka, and then we have some questions that have come in too. I think I started with you first the last time. Did I? I think so. We'll start with Shelby, and we'll make sure everybody gets it.
Maryville Baptist Church filed a lawsuit against yourself, and they said they claimed that you targeted this church. There was also a comment made that they're comparing the church, people gathering there, and then people gathering at grocery stores and liquor stores, and there was no citations for those people. What's your response to that?
Oh, the question is on a church that's filed a lawsuit because they engaged in a mass gathering. When we look back at last Sunday, all over this Commonwealth, whether it's our more than 5,000, I think we have many more than that, houses of worship, whether it's anywhere else that had previously been holding mass gatherings, it could be sports or the rest. We only had one statewide. While that one has gotten a lot of attention, how about the 5,000 plus that weren't holding them, that were doing the right thing? I believe that we have more people and more groups doing the right things across Kentucky, more pastors looking out for their flocks, making difficult decisions, but knowing they're protecting lives. I think we have more of that here in Kentucky than anywhere else, and I am very grateful for them. As far as the lawsuit, that used to be what I did. I'm not concerned about it. There were options for that congregation to either come up for a drive-up service because they had the ability to do that, and I've supported that all over the state. There was an opportunity for a virtual service because it was on Facebook. So two options that didn't expose anybody to the coronavirus that were still out there. And then what I think we'll see is that there was not social distancing, and that's of great concern. We have examples all over the country about how deadly any mass gathering can be. We have one from Western Kentucky that we have people that we know we have lost. Very first one in Harrison County, we believe, was spread through a worship service. We've got a Washington State choir that has multiple deaths and almost half the choir coming down with it. God gives us wisdom. And virtually all of our faith leaders are leading with that wisdom. I know we all want to get back to being able to be, in person in congregation. And I've told y'all, we missed my son's baptism 6 days ago. It was a big day for all of us. It's a real big day for him. But it's just the right thing to do right now. And my belief is, while we've had to worship differently, maybe we have maybe it's I bet there have been more people participating in a drive-up service or watching virtually than we might even have on a typical Sunday, because maybe it's just reminded us how special it is. All right, what do I recommend for people planning large weddings tentatively scheduled for September or October? Well, we are watching, obviously, the numbers. We've given you the benchmarks, but I would look at the guidance we showed yesterday, and we'll look at it more in depth on the phases. So the White House guidance, even in phase 1, is 10 people or less at anything. Phase 2 is 50 people or less. And so you think about the time that we'll be working through those phases, and I'd watch that very carefully for anything with 250 people. Eleanor?
I guess with the benchmarks, the 14 days, do we have any idea on more specifically on what kinds of things will open first? Is there any sort of priority with that?
The question is as we look at our benchmarks, what do we think will open first? Again, it'll be based on the data and the science. I think the first place you'll see easings of restrictions is in our healthcare sector. If we have enough PPE or areas that don't require as much PPE in a way to practice, and first of all, our healthcare system has done an amazing job with telehealth. I don't think health will ever be exactly the same again because of how effective telehealth has been, and I don't think we ought to undo all the changes and regulations we've made to allow telehealth. But we've got some folks that are showing up at the ER sicker than they would normally be, and we need to make sure that folks are getting the help that they need. That's the area that I think you will see first. And then areas after that will be areas that can follow the CDC guidelines. That it's probably easier just because of the way that their industry operates. And then I see it growing from there. But again, capacity of whatever it is, I would expect to start lower and grow. So let's remember it's going to be gradual and it's going to be phased, and it's going to be a new normal. When we have an opportunity to be out more, we're going to be recommending that people are wearing cloth masks. Don't wear the N95. Our healthcare folks need them, but it's definitely going to be a new normal. Question, what will be the enforcement measures for people who refuse to isolate? Our local health departments have taken over those roles. You've seen Jefferson County take some steps. You've seen Nelson County take some real steps. We trust that to those local health departments. Joe.
President Trump has been encouraging demonstrations in states, particularly with Democratic governors, for people that want to reopen the economy immediately. Do you think the president is applying unfair pressure on you and your administration to open faster than you may have wanted to?
The question is the president encouraging, or I guess possibly encouraging, some demonstrations around the country, and do I feel pressure to open earlier than we otherwise would? I don't feel pressure because the guidance, which is what I look at, the guidance that we have been given is in line with what we believe. The guidance at the White House that President Trump has put out suggests cases ought to be going down for 14 days, that we need to have sufficient testing capacity, that it has to be phased and gradual, that we got to be able to follow social distancing guidelines. All of those things are when you peel back away. I don't know how to term it. I don't necessarily think it's politics. Maybe it's rhetoric. Maybe it's the need on cable news to fill up an hour. But when you tear all that back and you look at what the actual guidance is, it's really in line with what we're doing. A health center in Louisville's West End had a drive-through free testing site today that was open to anyone, whether they had any symptoms or a doctor's note. Are we at the point where we have tests available to be testing people who are asymptomatic? Answer to that is no. We want to get there. We're working to get there. But our testing capacity is still fairly limited, and the number of people with symptoms or in the risk areas is still pretty high. Yes, it is an absolute priority to get there, and it's what we need to do and why we're working every day with Gravity ramping up and hopefully others around the country. But remember what I mentioned before is it's not our capacity. It's not, U of L has great capacity. They've increased. UK is increasing their capacity. Gravity's increasing their capacity. The question is, do we have the materials, the swabs and the reagent, or with some of these rapid ID testing that we have now, it's cartridges. So we were provided 15 rapid test machines. I say machines, they're pretty small, but only 100 kits or cartridges. So it's great to have 15 machines, but you can only run, 120 tests. All right, where was I? Are we going back around again? All right.
Wedco Health Department, Dr. Krista Miller announced that they're changing the protocol for what they consider a person is recovered from COVID-19. So there's going to be, you have to be asymptomatic for 3 days, or asymptomatic for 7 days, no fever for 3, and then you have to do the quarantine for 14 days. Do you see that happening in other counties and other health departments? And do you think that'll change our numbers?
The question is about Dr. Crystal Miller, who heads the Wedco Public Health Department, does a really good job, was here with us early, worked in the very first cluster that we saw here in the Commonwealth, and some new ways she's looking at what she considers recovered. Someone having recovered, we're going to need to reach out to her and talk directly, and we'll ask this question to Dr. Stack tomorrow to get his opinion. I wanted to see if Governor Beshear would have immediate comment on the lawsuit. We provided that comment. I'm confident that we have done everything within our authority, that we have provided other options for people to worship, that we are treating all mass gatherings the same. It's just that on that day there was only one across the entire state because everyone else was doing it right. We believe that the state police responded to over 30 calls on mass gatherings that day, and when they showed up, either no one was there or they were doing, if it was a service, a drive-in, or there was not a mass gathering. So nobody's being singled out. It's just one group refusing to follow the requirements while everybody else is doing it. And I will tell you that these challenges across other states are challenges to drive-in services, that we have been trying to provide as much flexibility because we know the importance of faith and of these services. Eleanor.
On Green River Correctional
The question is calls that have suggested there are 20-plus people in a cell at Green River. I would certainly hope that's not the case. We'll look into that. I have not gotten that word. I know there's been an attempt to separate those that have tested positive. The challenge here is just like the challenge in the long-term care facilities, except overall the population in Green River is not as vulnerable, but it's still a closed environment. It's very concerning. Joe.
Going back to the difficulty of obtaining the swabs for the test, has it been as difficult to obtain the swabs as it has previously to get PPE? And are you encountering some of the same issues where you're having to compete against other states or the federal government to get the swabs?
The question is on testing, the difficulty in getting swabs, the materials that let us test. Is it similar, more difficult than the difficulty we had with getting PPE earlier? It is difficult, and systematically, it's probably the same challenge. We are having more success getting swabs than we had previously been in getting PPE. I mean, if you go back 2.5, 3 weeks ago, the challenge with PPE, and it's still challenging, it's just loosened up a little bit, was more difficult than getting swabs right now. But the number of swabs we're going to need moving forward, the number of cartridges is significant. And what we'll see is that it depends on which test that we're talking about. So right now, swabs are tough, but we're still getting enough to do the programs we have right now. But we need significantly expanded testing. But the cartridges for Abbott's rapid ID test, we haven't been able to get anymore. Now there are some other groups that have been able to do some testing that seem to have them, and I don't know which direction, but it's always a real limited number. So when we look at wanting to do a drive-in testing site and why it took us so long to get our partnership up, we got to sustain it. And I don't want to set something up, we do 100 tests, and then we don't have anything for a week. We want to make sure that we have a real program. And when we get to the full capacity testing that we need, it's going to be programs all around the state, through health departments, through hospitals, on demand, needing to have a kit when it's there, and we're not there yet. Every state is facing this challenge. Now, in Kentucky, we don't have one of the national labs, and there are a lot more labs now, but the really big ones in our backyard, like some others did, but even there's some challenges. What we do have in our positive is we have fast turnaround times in Gravity, our state lab, UK, and U of L, and the more that we can make sure that they get the swabs, the better off for us. If it's a national lab and it's 10 days, as opposed to ours and it's 1 day, 2 days, then we can be more effective in how we respond. All right, we'll go around one more time. So, Eleanor? Joe, one more?
Yes. So, contact tracing.
Yes.
Obviously, you need testing to go up, you need more materials for that, but part of reopening, a big part of those contact tracing, and I assume you're going to need a lot more people to do that.
Oh, yeah.
Specific plans in place to increase the capacity of workers who can actually do that.
So the question is on tracing and then on testing and then contact tracing, because on opening up, that's a really important part. And it's both to make sure the people who have it, we identify them through the testing, and then we can trace their contacts, because if you can put a bubble around that, right, and everybody's self-quarantined, then we're able to get out and we're able to do more because it doesn't continue to spread. So it doesn't just take the testing capacity, which we talked about. It takes the individuals for contact tracing. We're going to be using a lot of the CARES Act money directly on that. I believe I'm going to have a plan early this week that's going to identify some initial first numbers that we think they're going to be large. And it's going to be hiring a large number of people from now till whenever we defeat the virus. The CARES Act money has to be spent through the end of December. But you can expect a significant operation. Now, it probably won't look like other operations because it's in the midst of the coronavirus. So you don't think about X number of people, in one building doing it. You think about the type of telework that we are now seeing. All right. So I finally got this done. within an hour. Again, let's remember that there are 7 families of 7 individuals that we lost out there. Let's light our houses up green, and let's recommit to doing what it takes. Remember, although we can't tell you exactly where it is, there is a light at the end of the tunnel. While it is a new normal, we will come out of this. But let's make sure that we keep our eye on the ball, that we realize lives are at stake, and that we are strong and resilient, and that we don't let our anxiety or being a little stir crazy make us make decisions that aren't data driven and by the science. If we're going to pass the test of humanity, it's not going to be easy, and we're going to have to be strong enough. So let's make sure that we do this and we do it right. We're going to close with another message from one of our faith leaders, given that we are in this weekend. This is Pastor John C. Lee, Jr. from the Mount Zion Church in Bowling Green. See you at 5 tomorrow.
My name is John C. Lee, Jr. I'm the senior pastor of the Mount Zion Baptist Church of Bowling Green, Kentucky. According to Hebrews chapter 13 and verse 17, the people of God are instructed to listen to their leaders. But to whom much is given, much is required. I want you to know that I understand how difficult it is as a leader to make decisions in this season. The decisions that we make in this season could be the difference between life and death. I want you to choose life. I believe that by choosing to encourage our people to stay home and stay safe, we're choosing life. That's the message that I want to remind you of today, even as we're tasked with the responsibility of watching for the lives of the people that God has given us to lead. And secondly, remember this, we are ultimately accountable to God for what we do. God bless you.